Okay, good evening. I'm Elvin Gonzalez. I'm going to demonstrate thorax and lungs assessment. First is to perform hand hygiene and then clarify or identify the patient. Good evening. I'm Elvin Gonzalez and I will be your next practitioner of today. May I know your full name and your day birth?
My name is Edward Henry Gonzalez and my birth is November 10, 2008.
Okay, now explain to the patient about the assessment that you are going to assess. Today, we are going to assess thorax and lungs assessment, and this will identify if you have respiratory problems. Do you have any problems? No? Okay. Okay. Mr. Gonzalez said, nothing, make sure that you close your third inner door to maintain client's privacy, and then have a patient undress if you needed assist the patient to sit position and expose the posterior virus, and then inspect the posterior torrent, examine the skin, bones, and muscle of the spine and back, as well as symmetry of expansion and accessory muscle. And then assess the posterior and lateral diameters of the spine. After the palpate over the spine and posterior thorax. After your palpates, use the palmar surface of the hand. The palpate the temperature, tenderness, muscle development, and masses instructions. To take a deep breath, assess for the tactile parameters by using the ball of the hands. Palpate over the posterior thorax, and while the patient says 99. Says 99. Say 99.
99. 99.
Okay, expansion by standing behind of the patient, placing both thumbs on either side of the patient. Spine at the level of thoracic 9 or transect 10 as a patient. To take a different and no movement of your hands. Inhale, straight one. Inhale, exhale. Inhale, exhale. Inhale, exhale. And then forecast over the posterior lateral lung. Fill the throne using zigzag pattern, starting above the scapular to the basis of the lungs. Notes intensity, pitch, duration, and quality of the sound. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Okay, and then sculpted the lungs or across the down posterior to the rest of bases of the lungs as the patient breathes slowly and deeply through the mouth. Malalim. Then examine the anterior thorax with the patient sitting. Arrange the gown so the interior chest is exposed. Inspect the skin, bones, and muscle as well as symmetry of the lung, expansion, and accessory muscle using palpate interior thorax using the proper sequence palpate for the tactile parameters as the patient. Then after that, forecast over the interior tower. After using the proper sequence, I sculpted the lungs through the interior thorax. The patient breathes slowly and they bleed through the mouth. Slow lang yung ano. Slow. 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 After that, inspect the breast and axilla with the patient. Hand resting on the both sides of the body. Place hips and then raise above the head. Hinga ka ng malalim. Yan. Inhale. Exhale. Inhale. Exhale. Hands, arms resting against the side of the body. Assess the patient into the supine position place of the small pillow or towel under the patient back. Palpate the breast, nipples, and wear gloves if this appropriate. So, can you breathe out? Lower back, lower back. The patient is in replacing the gauze removed gloves in any addition if you abuse the and perform hygiene just the patient. So after the document and evaluate all your data